Hysteroscopy is a gynecological procedure where a very slim telescope is placed into the vagina with the intention of trying to enter the cervix and ultimately enter the womb in order to assess if there's any problem with the womb lining or the inside of the womb. This is typically done for women who have problems with abnormal bleeding, and this can be premenopausal or even postmenopausal women, and also sometimes for women who have problems conceiving and having fertility investigations. Colposcopy is an outpatient procedure which is very similar to when you have a cervical smear test. So the doctor will insert a speculum into the vagina, which is a device that allows them to see the vagina and the cervix, and then uses a special microscope after applying some special stains to the cervix to see if there are any abnormalities with the cervix that could be cancer or precancerous changes. So with the colposcopy, we're not actually entering the cervix or the womb, but we're simply looking at the surface of the cervix. So you could probably consider colposcopy to be a little bit less invasive than a hysteroscopy. When we compare this with laparoscopy, laparoscopy requires the patient to have a general anesthetic. So they need to be fully asleep, unconscious, and they won't remember or feel anything during the procedure. But in this case, we make little cuts on the tummy, typically in the belly button, and a few smaller cuts lower down to allow us to place instruments into the abdomen so that we can visualize the genital structures from above. So we can assess the outside of the womb, the fallopian tubes and the ovaries, and the areas in front and behind of those structures to assess for gynecological problems. So the hysteroscopy procedure, the way I like to explain it is we start by placing the patient on an examination couch and typically in stirrups. What we will then do is very gently examine the patient and place the telescope at the opening of the vagina. We then turn on some fluid or water, which is slightly lukewarm so that it feels more comfortable. And then under direct vision, we slowly advance the telescope to the level of the cervix. Once we can visualize the cervix, what we then do is we very gently negotiate through the cervix until we enter the inside of the womb. When we enter the inside of the womb, this fluid will fill the inside of the womb so that the doctor can have a clear view of what's going on inside the womb. So we might find that there are polyps, which are little fleshy growths inside the womb, fibroids, and sometimes we can assess precancerous or cancerous changes as well whilst doing this test. So it's really very, very useful for us. The procedure doesn't take long. It probably takes about 5 minutes if we just want to go in and have a little look. But you're quite right that it can be painful. For most women, we would say that it is tolerable and there's a degree of discomfort that's to be expected, because as the womb is filled with the fluid, you'll feel a sort of crampy feeling inside your tummy, very similar to having period pains. As most women will have some degree of period pains, this feeling will not feel unfamiliar, but of course it can be unpleasant because the sensation comes on really quite quickly. For a small proportion of patients, it will be too painful, and our general feeling is that we won't want to hurt our patients. So if at any point the patients feel painful, feel too much pain, then it is important that the patient expresses this to the doctor so that we can stop the procedure. Hysteroscopy is thought to be a very safe and procedure. It's typically done in the outpatient setting, so that means the patient is awake. But it can also be done whilst the patient is asleep, so under general anesthetic or under deep sedation. The risks of the procedure, whether it's awake or asleep, are fairly similar. So the patient will experience some pain, and that could either be pain during the course of the procedure if they're awake or afterwards. And this is a sort of, as I explained, a sort of crampy discomfort. There will be a small risk of bleeding, which is usually not very much. And that bleeding or discharge may go on for a few days after the procedure. There's also a small risk of infection. Typically, the quoted rate of infection is about 1 in 400 cases. And we ask patients to watch out for any signs of infection, such as increasing tummy pain after the procedure, a smelly discharge, or feeling sort of generally unwell. During outpatient hysteroscopy, patients can also experience what we call a vasovagal episode, which is when they have a slight drop in their blood pressure and heart rates. And this can make them feel faint, lightheaded, or giddy. So I normally say to my patients, if they feel unwell in any way, they should mention it to me, and we can then manage this for them. It's usually a transient feeling, but of course it can go on for a bit long in a small cohort of patients. So the doctors can manage it relatively simply. This is unlikely to happen if you have it done under general anesthetic. The other slightly more serious risk of the procedure is the potential to cause an injury to the womb. And we say that the rate of this is about 1 in 1,000 cases. So it's fairly uncommon, but of course it is quite a serious risk. If we were concerned about this sort of injury, then we would typically admit the patient for a period of observation. But it is also important to understand that if there's a genuine risk about a serious injury to the womb, that the patient might need to have to go to theatre to have the injury assessed and repaired through keyhole surgery, and very rarely even by a little cut on the tummy. So for hysteroscopy, most women recover really well from the procedure. They will experience some cramping discomfort for a few hours or up to 24 hours after the procedure. And we typically recommend taking some pain relief. Paracetamol, ibuprofen should be more than sufficient to improve the discomfort associated with the procedure. Usually by 24 hours, most women won't have any, significant discomfort. They might still have a bit of bloody discharge or bleeding, which could go on for up to 7 to 10 days, depending on exactly what's been done during the hysteroscopy. And most people will find that they can go back to normal life, relatively quickly if they've had it in an outpatient setting. Of course, if they've had it under general anesthesia, then there may be some additional time that would be required to recover from a general anesthetic, but usually it's not considered to be a major surgery. It's typically done on a day case basis, which means you would come in and have the procedure done, go home on the same day. And so therefore people are up and about and getting back to their normal lives quite quickly. Sure. So the results can be reviewed between the doctor and the patient, depending on preference. Typically, if biopsies or samples have been taken from the inside of the womb to investigate things like abnormal bleeding, then the doctor would typically relay that information to the patient by a telephone consultation or face-to-face, if that would be the patient preference. And in some situations, the patient may choose to just receive the results through a letter form, and that could be arranged. Obviously, this is on the assumption that the results were normal. If by any chance the results come back showing something unexpected or abnormal, then it would probably be more appropriate to arrange a face-to-face consultation so that can be more thoroughly explained, and any questions that the patient may have can then be answered at that time.